Greetings and welcome back to our YouTube channel. My name is Dr. Paul Kazungu, medical doctor and M&E specialist in health sector. I would like to welcome you again in our discussion pertaining to monitoring and evaluation system setting in public healthcare facilities. I have a vast experience after serving in clinical practices for 14 years and 4 years of experience in managerial position, leading clinical audit and quality assurance, unity, monitoring and evaluation, as well as risk management. So I would like to share my experience and the expertise to enable my colleagues in the health sector to navigate this journey of establishing a M&E system in their facilities in a smooth manner. But again, if you get stuck and you feel that you need assistance, please contact me. I also offer consultancy services in establishing monitoring and evaluation, designing project and the program plans, as well as conducting monitoring and evaluation, facilitating in risk management in healthcare, as well as setting up many systems in various projects and programs. So do not hesitate to contact me in case you need an assistance. So today our discussion will be on the prerequisites for establishing robust M&E systems in public healthcare facilities. And this has come because of the government ongoing effort in enhancing efficiency and effectiveness in public sector. Thus, I have decided to prepare a series of presentation to join hands with the government so that monitoring and evaluation practices, culture, and of course, decision making driven by data becomes a culture in healthcare facilities. So our discussion will be centered on the prerequisites for setting up M&E system in public healthcare facilities. Now, number one, you need to conduct an M&E readiness assessment. Prior to setting up your M&E system, you have to make sure you know the current position in terms of capacity of your facility. So conducting an M&E readiness assessment will provide you with an understanding of the current status of capacity, and it will highlight gaps, and then you'll be able to identify areas where improvements are necessary to fully comply or other to be able to establish the M&E system in your facility. Now, the second thing is preparing an M&E annual action plan. So public healthcare institutions are required to prepare M&E annual action plan to specify the key areas where they will be monitoring. Okay, so reflecting the healthcare institutions overall annual action plan is also very important, as the indicators from the M&E will also reflect the indicators in the annual action plan. Okay, of course, this will ensure that monitoring activities are aligned with the institution strategic objectives and the priorities. A third thing that is very important is developing an operational manual. This again gives details on how the daily M&E activities will be implemented. So the manual should describe how the various units, sections, and the departments within the institutions will adhere to the M&E guidelines, as well as outlining clear roles and responsibilities across all levels. Okay. And the fourth thing is nominating M&E champions. This is again very important to make sure that the least participatory approach in developing as well as conducting the M&E activities in your facility. So each healthcare facility that is planning to implement M&E system must nominate M&E champions from all units, sections, and the departments, so that these champions will work closely with the M&E units by ensuring that each department adhere to the guidelines and they contributes to the overall M&E objectives of the facility. Another thing is strengthening the M&E unit. In this case now, the heads of the healthcare facilities should strengthen the M&E units by allocating sufficient financial resources, supporting the implementation of M&E activities. Now, having a well-resourced M&E function will ensure sufficient monitoring and evaluation processes within your facility. And number 6, implementation of M&E frameworks, developing and implementing standardized M&E frameworks that align with the national development strategies as well as institutional objectives. And the framework should include clear indicators, targets, and performance monitoring mechanisms. These are very important as they will make sure that everything that is done within the healthcare facilities aligns with the national development strategies and hence contributing towards the national development goals. Number 7 is the capacity building for M&E personnel. We have already nominated the champions, but again, these champions, most of them are not trained in medical, are not trained in M&E. So they have to be equipped with the M&E skills and knowledge for them to be able to perform monitoring and evaluation tasks smoothly. Okay, and again, the capacity building should not be a one-time thing. It should be continuous capacity building programs that will ensure that the M&E champions are well equipped with the knowledge and the skills, and they are being updated every now and then. Another thing is on utilization of M&E findings. Now you have established the M&E system and it's doing very well, collecting the data, analyzing the data, giving out the results. But if the findings are not utilized in improving the services or the programs within the public healthcare institution, then the M&E system will be of no use, because the whole thing of M&E is to make sure that we improve the situation as we learn from the findings we obtain in the daily M&E activities. So public entities are encouraged to establish feedback mechanisms that ensures that M&E results are communicated very well back to the relevant stakeholder for action taking in order to improve situation.